Our typical hernia patient, after they undergo surgery, will have 3 to 5 days of discomfort. You're going to know that you've had an operation. Typically by 2 weeks afterwards, you're somewhere in the 80% range, meaning that you're up and around, you're doing the things that you normally do, you're ready to return to work, but occasionally you're going to cough or sneeze and be reminded that you've had an operation. Most of those zingers, is what I call them, will go away by about 6 to 8 weeks after surgery. So what we'd like to do within the hernia center is patients can have their operation, return to work, light duty at 1 week, full duty at 2 weeks for your standard hernia.
Robotic hernia repair has really just been the next step in the evolution of how we repair hernias. We started doing open hernia repairs back in the 60s, 70s. Then mesh was introduced. That really took us to another level. Then we went to minimally invasive hernia repairs in about the 90s, and that decreased pain, decreased post-op infections. We had little bitty incisions, so that was great. But now the robot is a laparoscopic tool. So it's just like laparoscopic surgery where we have little bitty incisions, but now instead of straight sticks that we're operating with that have pinchers or scissors on the end of them, we now have wrists on the end of those instruments. So everything that I can do with my hands, I can do inside the body now. So when it comes to hernias, this is awesome because now we can just sew those muscles back together. And that's really our goal with hernia repair, is to reconstitute the abdominal core muscles. Close that hole, reconstitute those core muscles to give a patient back all of the function and the strength that they had before. Patients today are pretty savvy, and all of us have been able to take advantage of getting on the internet, looking up things. So when we have a problem, I know I'm one of those that goes onto Google or goes onto ChatGPT and says, hey, and I think that that's fine. I don't discourage patients from doing that. I discourage patients from stopping at that point. The key is use that to then get you to the next step. So, I think that probably the best way to find a surgeon to help you with a hernia would be ask your primary care physician. 2, do your own research. Look online, find people that do this for a living. I always say if you want the best person that changes right rear tires, then find that right rear tire changer. You want to make sure that this is something that somebody does all the time.